two, two, one. You're now
all right. Hello, everybody. It's Dr. Alex Earle and Dr. Vidal, and it's Hump Day. Dr. Alex Earle here at Pure Plastic Surgery, and it is the last Hump Day of 2023. I know, we're all incredibly sad about that, but we are doing what we always do now on the last Hump Day of the year. It's when we talk about our BBL stats. So I believe this is the third time you've done this with us. Is that correct? Okay. All right, Dr. Vidal, third BBL stat Hump Day, and I've been doing it pretty much since I started Pure, so I think about 5 years now. Okay. I don't know of anybody else that does this. We're completely open. These are our stats. Okay. So you got to know anything about our rates regarding BBLs, well, it's right here for you. Go ahead and take a picture if you want, but this is it. All right, so Dr. V, why don't you kick us off with the first stat here today?
Thank you so much, Dr. Earle. So we're going to start talking about fat retention. Why is this so important? What is it? It's the amount of fat that when we transfer it, it survives. And why is it important? Because it has to do not only with the surgery itself, but the post-op instructions and our recovery protocol to be very strict with the no pressure for 6 weeks. Not everyone does this. But we are very strict with that, and I have a lot of patients. As I had friends that had the BBL done in other places, and they let sit their patients post-op day 1 or 1 week. We're very, very strict because we have good fat retention percentages in our numbers, and that's why we're very strict with that. So nationwide, and we're going to be comparing our numbers with the national average. That's the first column that you guys see here.
That's what you see here. So these are the national averages. This is based on studies that are out in the literature that, of course, that everybody could look up themselves. But that's where these numbers come from. This comes from the plastic surgery literature.
Yes, so we're comparing it to the 50% survival rate of fat. That's what's documented for BBLs. And why is it? Because the fat, when we transferred it, needs to build up new blood vessels, and that takes time, and that's usually around 6 weeks, and that's why we keep our patients from putting pressure to the buttock for 6 weeks. After 6 weeks, you get new blood vessels, and that fat may get pressure, and it's not going to die because it developed its own roots in the buttock and now has its own blood supply. Okay, so our fat retention rate is 70%, so it's very high, higher than the national average. It cannot be 100%, unfortunately, because there is some fat that is going to be lost with that process of blood vessel formation. I think this is the best we can do. Of course, we keep on up to date, with education, things that we can do to make this number better, but this, having it better than national average and by 20% better, I think it's a great number for patients.
So I think that's really, really good, and we're talking, we're talking about large volume fat transfer, right? So we're talking about transfer to the buttock and hips is large volume. It's not the same as say you're talking about little tiny volume fat transfer, like for those facial plastic surgeons that do it for the face. Of course, their retention rate is going to be higher because they centrifuge the fat, they put PRP, they do all these things, but it's not the same thing, right? We need to be comparing apples to apples, not apples to oranges, okay? The other thing related to this that's come up lately because we've started using the Vaser is that people have heard that in the past, the Vaser actually would lower your fat retention rate. So that's not longer true anymore. We have like the latest machine, all right, the most up-to-date machine, which is able to still use that ultrasonic energy and not destroy the fat cells. But of course, also important is the settings that we put. So there are certain very specific settings that you can use for fat transfer, which will keep those cells viable. That's what we're using now here at Pure. Okay? All right, so next, the revision rate, okay? Yes, I get hammered about this every single year, okay? And people are like, Dr. Earle, why you have revisions? And that's why every surgeon has revisions. The only thing is that I'm open about it. I'm completely open about it. Yes, I have revisions. And guess what? When you go to the national average, so do 10 to 15% of patients come back for the revision rate of about 10 to 15% in the national average when you put all surgeons combined, okay? So, I went through all our numbers. Oh, first of all, we didn't talk about our total numbers.
Yes.
So, how many BBLs did we do in the year? We did close to 500. So, we did 476. I did about 322, and Dr. Vidal did about 54. Okay, so we're talking, pretty big numbers, a very good experience. We do BBLs here day in, day out. There's 365 days in a year, so it's a BBL a day, a BBL and a half a day, I guess. So we're pretty busy with this procedure, so we really know what we're doing. And our revision rate is 6%, okay? So it's not 0, it's not gonna be 0, it's never gonna be 0, okay? But it is about half of the national average. So our revision rate for 2023 is 6%, okay? So, those of you that can do the math, if you multiply 6% times nearly 500, right? That's going to be what?
30? 30?
Yes, it's going to be about 30. That's about 30 people, right?
Yeah.
So if you're in a room with 30 people and they all have revisions, you're going to say, "Oh my Lord, they have a bunch of revisions," right? But you're not seeing the whole picture. We do 500 BBLs. Of that, yes, there are 30 people for a revision rate of 6%, which is actually half of the national average, okay? But there's nothing to hide here, all out in the open, all right? If you have a BBL at Pure, there's about a 6% chance you may need some sort of refinement or revision.
And also it's important that your surgeon is open to talking about revisions, right? Because if you go to a surgeon, it's like, no, my patients don't get any revisions, it may be that he's just not listening to their patients and not listening to their concerns after the surgery. He's like, no one needs a revision. That's not okay either, we have to be open to our patients, their results, and be cognizant that there are some people that's going to be revision.
Yeah, and we want our patients to be happy, which is why we do it, right?
Yeah.
You could say I have a 0% revision rate, just deny all revisions,
Yeah.
and then that's not going to work either. You're going to have a whole bunch of unhappy people.
Yes. Okay, let's go to the next one, round 2.
Okay.
So what's a round 2 is different than a revision, okay? Round 2 is most of the time foundation and also goals related. So patients that either want a very dramatic transformation or they started with a foundation that wasn't favoring a very wide hip or projection in the buttock, and with only one round wasn't able to get to their goals, okay? So here we are at our national average, which is good because it means that we are keeping the majority of our patients very happy with their round 1, and those that either have a foundation that don't stimulate or put them in a good position for getting the results, or they want a result that is very dramatic, then they come back for their round 2.
That's right. So that's the one thing to note is that nationally between a revision or refinement or round 2, it's about 25% of people, right? For us, it's a little bit lower. If you combine these two numbers, about 21%. But that means that roughly, and this is something everyone should know, if you're going for that first BBL, there's about a 1 in 5 chance you're going to come back for another, for one reason or another, okay? So, you're saving up for that first BBL, you might as well maybe save for both, right? But it just happens, that's just the way it is, it's the nature of this surgery, okay? And so nationally it's going to be about 1 in every 4 people that get a BBL come back for round 2, here's about 1 in every 5 people or so.
Yes.
Okay? Alright, so we're up to the next one. I love this one. You know why I love this one?
I'm very happy about this
Yes,
one. Very
because
happy.
it has been continuously coming down since we opened Pure in 2018. So, if you guys go back, and I know none of you will, but if you go back to my Instagram in December, back 5 years to the very first one of these that I did, my infection rate there was still a bit lower than the national average, which is 10%. But my infection rate there was somewhere like around, if I remember correctly, around 6% or so. And it's been, every year, it's been lower and lower and lower. And Dr. Vidal came in, and she, of course, employs all the safety and infection protocols as well. And we've been adding things too. So now we use like the UV light before we go into the room, basically kill anything that's alive in there. It kills not only bacteria, but also viruses. That we started with COVID, which is actually one of the great side benefits of COVID was that we discovered the UV light, and that's really helped bring our rate down. The other thing that we're doing now that we didn't do before is that we change the cannulas every 6 months. Okay, before we even have a problem, we just go ahead and throw out all the old fat transfer cannulas and get a whole new set every 6 months. Okay, and then of course we continue with our protocols of IV antibiotics at the time of surgery, oral antibiotics after surgery. We put antibiotics into the fat before the transfer, and we re-prep the patient before we do the fat transfer as well. So all that remains, and guess what? This is the best we have ever done, and it's really impressive, okay? Because we're doing surgery near the anus, guys, come on. So okay, and this is really impressive.
Yeah.
We have gotten down our infection rate to 0.5% for 2023. Now,
Amazing.
I don't know if it's gonna stay that way,
Yeah.
honestly, okay? We had a great year.
Yeah.
We had 2 infections. In
2
the-
of 476 patients.
in the entire year. That's pretty amazing.
Yes.
And you're not gonna see that.
And also
almost
good
anywhere.
to mention, of the 2 infections, neither of them needed another surgery.
Yes.
They were okay with just IV antibiotics, which is a great benefit, because when you need an incision and drainage or opening up the infection, we then end up with divots or scarring or other
Scars,
things to
yeah.
revise in the buttock, which neither of them needed, thank God.
Yes. So yeah, it's been a terrific year. I'm not gonna guarantee that we're gonna keep doing and having the rate this low, because like everything, things fluctuate, right?
But we're gonna try our
but
best.
we're definitely gonna try our best to try to keep it around. I would say around 1%.
Yeah.
Which is our goal. If we're below that, even better.
Yeah.
All right.
Okay.
Next one, and this one's good for this year, because a lot of stuff happened regarding this year. The ultrasound use.
The ultrasound use, but I'm confused with this one.
Well, we use it all the time.
I'm sorry, guys.
Okay,
I'm
okay.
thinking here of Baser, because we're talking about Baser and he said ultrasound.
Oh,
Okay.
but actually, let everyone know what's the difference between ultrasound imaging
Yes.
and ultrasound energy.
Correct. So sorry, I was thinking about ultrasound energy, because we were mentioning Baser on the revision rate of that fat retention rate, and we did incorporate the Baser this year, which has been
Yes.
very, very good. I've had a lot of patients with the Baser already. Very, very impressive results with skin tightening, and also with the recovery, less bleeding, so they recover a lot better. So if you're considering doing a BBL, really consider adding the Baser.
Yes.
Uh,
And for skin retraction.
Correct. Skin retraction, bleeding, very, very good. And the bruising. The bleeding is associated with the bruising. Yes, Willie. Willie's doing his literature review. So an ultrasound imaging is what we use when we're transferring the fat to the buttock area. So the mortality rate associated with BBLs has been studied very much in the last few years, and has been associated with what it's called fat embolism. So the problem is that the vessels and the veins in the gluteus muscle are very large, and the anatomy of the gluteus muscle has differences with other areas of our body, which then increases the risk of having that fat go into those big blood vessels and travel to your lungs, and causes an obstruction of the blood flow to get oxygen, and can be deadly. And it can't be deadly immediately, instantly, in the operating room, or very soon after the operating room. So there's been a lot of research taking and looking into the anatomy and what causes it, and how can we prevent this. And unanimously, it is using an ultrasound to visualize where you're injecting the fat, so there is no risk of going into the muscle. And we hear surgeons saying, oh, I've done this many times and I've had a lot of experience, but unfortunately, the numbers are there, and surgeons that have unfortunately had patients pass with fat embolism have been surgeons that have done the procedure multiple times, and they were thinking they were injecting above the muscle and away from the muscle. So even if you are experienced, even if you've done this thousands of times, the anatomy of each patient is different, so that is why you need to look at it and visualize it, so everybody's safe, there's no fat embolism, and this procedure is a safe procedure. So we use it for every single case. 100% of our cases,
100%.
we use ultrasound, and I've been using it since I started doing BBLs.
Day one.
And correct. So all of my BBLs have been with ultrasound usage, and Dr. Earle has been using it 2019, which is
Yeah.
one of the pioneers of ultrasound use, because in 2019 probably no one was using ultrasound for this procedure.
Yes,
So-
and not only that, we actually, we just wrote our experience with that. You know, Dr. Vidal, did a lot of the writing. Yes. But we just wrote up the experience of all our ultrasound guided BBLs, which in total were close to 2,000, about 1,800
1,800
cases between Dr. Vidal and myself.
Yeah.
And that just got published, right? Just
Today I got
Yeah.
the email that it got published to the best aesthetic journal to plastic surgery worldwide is the
Yes.
C Aesthetic Journal. So we're very happy. We're very happy with that publication. It's coming in one of the future journals, but it's
Yes.
published already
And
online.
as soon as we have that link, we'll put it up for you guys so you can read the study.
Yes.
But it's a great study. It's basically one of the first, if not the first, large kind of volume in terms of number of BBLs that have been done under ultrasound guidance, and then showing our very, very low complication rates and our zero mortality and zero fat embolism rates as well. Okay, but right now throughout the nation, it's not being very used commonly. But in Florida this year, it actually became a law. So in Florida, it should be now currently 100% as well. That does not mean that it's the same for other states, right? Because you don't have the same laws in other states. So in other states, they may not be using ultrasound, although I think everyone should, okay? But it's certainly not the same for other states or other countries. But in Florida right now, every single surgeon that does a BBL needs to be using the ultrasound, okay? All right, which brings us to, of course, last but not least, and the one that everyone reads about, and it's still in social media, in the blogs, and this and that, and people are still misinformed, okay? But it's, of course, the mortality rate related to the BBL, which at one point in time, yes, it was 1 in 3,000, but that was 2017, people, okay? If you're quoting that data, you are like years behind, okay? And your technology is also behind. So the latest data, the most up-to-date data, shows a mortality rate of about 1 in 50,000 or less, 1 in 15,000 or less, okay? And this is taking all BBLs, okay? We have a group, I don't know if you all recall, I'm the president of the World Association of Gluteal Surgeons, which is a group of surgeons throughout the world that focuses on BBLs, and within that group, within our data, taking all comers, that mortality rate is even lower. It's about 1 in 25,000 with our group data, okay? And then if you were to take that and just take the people that only do ultrasound BBLs, I would think it's even lower than that. But we haven't done that study yet. We're gonna do it. We're gonna do it so everyone can see. But anyway, that's a very long-winded way to say that the national average today, 2023, is at least 1 in 15,000, if not less, okay? And of course here at Pure, we have had 0 BBL deaths, 0 fat embolism from BBLs here at Pure, okay? And that, of course, has remained since I started back in 2018. All right, and like we said, I started using the ultrasound in 2019 and done a BBL with ultrasound, every single one ever since then.
Yes.
All right, okay, so those are our stats. It's right there for everyone to see, okay? And we have time for some questions.
Yes,
Okay.
not too much time, but we have some comments. First of all, in Spanish, ¿qué clínica es y dónde se encuentran?
Esta clínica se llama Pure Plastic Surgery,
Sí.
Pure de puro, P-U-R-E. Estamos ubicados en Miami, Florida. Y pueden verificar en el link de esto es Instagram.
Esto es
Sí.
TikTok.
TikTok en el bio, ahí debe estar el link para nuestro website y ahí está toda nuestra información.
Yes, excelente.
Okay, is embolism with BBL 100% avoidable if you avoid going into the muscle?
So nothing, unfortunately, is 100% avoidable, right? Just like in life, like nothing is 100% avoidable, right? Even if you're the most cautious driver in the world, is it 100% avoidable that you're not gonna crash? No, right? So I can't tell you it's gonna be 100%. I can't tell you that the national mortality rate is gonna go to 0. That's never happened. The only way to have a 0% complication rate is to not do surgery at all, right? It's like to not drive that car, not get on that plane, not cross the street, okay? But Having said that, we can make it exceedingly low. Like I said, probably somewhere in the range of about 1 in 50,000, which is very low when we use the ultrasound for this procedure.
But it's good to mention that there was a study published about all the mortalities of South Florida in the past couple of years, and of all the autopsies of the patients that passed with fat embolism, all of them had evidence of fat in the muscle.
Yes.
Okay, so we can, like Dr. Earle said, we can't say 0%, but it hasn't been one mortality that didn't have fat in the muscle. Okay, so we can assume that if we're injecting above the muscle, and as our data suggests, then we can avoid fat embolism.
Yes.
Okay. You doctors are super safe and cautious with your patients. Thank you.
All right. Yes.
Okay.
Safety, number 1.
Yes, it's the patient that I know who she is. And now, yep. Oh, what I did here. If someone, this one is on YouTube. Yeah.
On YouTube. All right.
If someone comes in for their pre-op appointment for their BBL and they decide just there that they just want the 360 lipo and not the fat transfer,
Yes.
it will be a problem.
Well, after we incessantly make fun of them. Of course not an issue. I mean, every patient has to make, whatever decision they feel comfortable with, and that's really what we're all about. So that's why we provide do a lot of education. As you know, Dr. Vidal, she does her Tuesday tips. I do the Hump Day. Really, the main goal of why we're even on social media is to provide education for our patients. And yeah, we do some, some stuff for entertainment and whatnot. But the main goal is for education so that you're comfortable, right? And at the end of the day, when you come here and you meet us, we want you to be comfortable with us, with our team, with our communication, and with the procedure that you're doing, okay? And that's really the bottom line.
I can answer the next one.
Okay.
Can I?
Okay.
Do you offer high-def arm lipo by chance?
Yes.
Well, hey, I have my arms defined by Dr. Earle.
Yes, we can definitely do that, and Willie has gotten amazing results with it. Yeah, you have to be a good candidate, of course, but of course, send your evaluation, and we can definitely let you know if you're a candidate. But yes, it can be
And
done.
we're going to be doing, I think, more and more of those in 2024.
To all viewers, you will be in the best of hands. Book with the best doctors.
All right, thank you.
Love it.
Can we give hearts back
Yes.
to the camera?
Of course. Okay, do you suggest a tummy tuck before a BBL if you have significant weight loss?
All right, I'm going to let you take it away because I just put up a huge sign about this on the street. But go ahead.
Yes, we both agree on this, that the best procedure to start is a tummy tuck. Tummy tuck involves removal of the excess skin, but also in the muscle separation, what's called plication, or repairing that muscle separation. And with that, we can create a better contour of the belly, and we can do more even the liposuction. So doing the liposuction first can then create scarring and unevenness that cannot sometimes be corrected with lumpy bumpy, and cannot be corrected because of the scarring completely with the tummy tuck. So it's always better to do the tummy tuck first. Wait 3 to 4 months, swelling to calm down, everything is healed, and then you come back for the lipo or lipo BBL.
Yeah, that's the way you're going to have the absolutely best result for each procedure.
Is it possible to get a dramatic look with a skinny BBL?
Well, those things are not completely compatible in the sense that if you're a skinny BBL, then that by definition means you don't have a ton of fat, right? So it really depends on how dramatic you want to go. But there are going to be a lot of anatomic factors that come into play, okay? So, for example, you're a skinny BBL, but your frame, especially at the waist level, is small, right? Not everybody's frame at that level is the same. Some people have their musculature, right? Their abdominal muscles are a bit wider, and some of them, they're a bit narrower. Once we get to that muscle level, we can't do anything about that. We can't shrink that down, okay? So if you're naturally having a very small waist, then yes, we can do a more dramatic look for you because we'll use all the fat that we are able to take out to pop out those hips and give you some more projection, and there's a higher chance you can get a more dramatic look in one round, okay? But if you're, say for example, you have very, very little fat, the waist just naturally is not as narrow, All these things, or maybe your fat retention rate is not as great. All these things can come into place. You may need more than one round to achieve that look that you want, which is why, like we said here, there is a round 2 rate of at least 15%.
Okay, here at YouTube again. And yes, there's a lot of people. Those fat transfer to the hips only have risk of embolism.
No, so the risk of embolism is over the gluteal muscle. So if we are looking at the buttock from behind, it's the medial or central aspect of the buttock near the center. Once we go more laterally towards the hips, the gluteal muscle doesn't extend to there, so the risk there does not exist. It's the gluteal muscle itself, and that is why we call that area in the center the danger zone, because that area is where the blood vessels are and the gluteus muscle is.
Right.
Can you get a BBL with low vitamin D?
Low vitamin D. Can you? Yes, we're going to fix your vitamin D, right? So fortunately, it's not an issue that's tough to fix. We can give it to you orally or even IV sometimes. So the key is to fix that first and then go ahead and get your BBL. Not a problem.
You're experienced and super dynamic doctors.
All right. Dynamic duo.
I think this is not our patient, but she asked, how do we sleep after a BBL and breast augmentation? I'm dying.
I'm dying.
She's not our patient.
She's probably not our patient because we don't typically combine those procedures because that's one of the reasons.
Very hard to sleep.
Yes,
Very hard to sleep.
That's one of the reasons.
Yeah, so any procedure that involves just the front, like a tummy tuck, breast augmentation, breast lift, just better not to combine it with a BBL because you're going to be sleeping in your front for 6 weeks. So anything that applies pressure to that area, the breast implants, the problem with putting pressure to your breast implants is there is something called the capsule, or that scar tissue that forms around the implant that forms in everyone, and it actually holds the implant in place. If during your recovery you're putting tension and moving that implant, that capsule heals wide. So when you're moving around later on, the implant is going to be all moving around and not staying where we want to. So that's why when we do a breast augmentation, we ask you not to sleep over it for at least 3 months.
Yeah. And so then for the BBL, so then when you end up getting a mattress with a hole in it or a chair with a hole in it, but then you're putting some degree of pressure to the BBL, it becomes very complex. Your fat retention rate then goes up from, it goes down. You are able to retain, you have less fat retention, so you lose more fat. So you're really kind of compromising either one procedure or the other. And if you really want to have the best result of each one, I think it's best to separate out those procedures.
Would you ever do a recap on your mommy makeovers stats?
Oh, okay, we can do that. Not for this year though, because it's the last Hump Day this year. But we can catch it maybe early next year, and still recap 2023 Mommy Makeover Edition.
Great. How long should you wait to get another cosmetic surgery after a BBL?
Yeah, we usually recommend 3 to 4 months. That retention rate and that final result will not be visually apparent until 3 months out. So it's important to still continue with your nutrition, continue, you can start working out at 6 weeks and building that gluteus muscle strength to optimize your results. And if you go and do another procedure early on, you're then getting in a metabolically state that it's going to compromise that fat retention and your results. So it's better to wait 3 to 4 months after the BBL. And if it's liposuction, you should wait a little bit longer because liposuction, it involves a large area, so there's scarring below the skin, We don't see it, but it's there, and in order to do another liposuction procedure, we have to wait that scar to kind of soften and heal prior to going ahead and doing another one. So we recommend if you're thinking about a liposuction after a BBL to wait 9 months to a year after that first BBL.
Yeah, we're gonna do liposuction to the same area you had done already.
Okay, the last one. We're over time. Yes, Doug.
And we're gonna wrap it up.
Yes, sir. Until next year.
All right.
How long after a BBL is the risk for fat embolism to happen? After what amount of time can you be sure you're safe from that happening?
So I mean, that's a great question.
Yeah.
Most of the time, something actually happens like pretty much immediately, like instant. Okay. Can it happen after? Yes, it can happen sometimes shortly thereafter. Sometimes, say like in the recovery room, but it's not typically something that's going to happen, you know, like days after or weeks after or something like that. So usually, you know, certainly by the time if you've gone home, you're doing fine, you're doing okay, then it shouldn't be an issue. Okay, that's it. That's all. All right. Well, everybody, we have really enjoyed 2023. We want to thank all of you. We want to thank you that are our patients that are always on here. We want to thank our followers. It's really been a terrific year, and we can't obviously do it without you guys. It's been great fun as well. And well, we really, really look forward to like a great 2024. All right, but until then, everybody, happy holidays, Merry Christmas, Happy New Year, and all those good things. I hope everyone enjoys some time with their friends and loved ones and families. And
yes, Feliz Navidad,
Yeah.
Próspero Año Nuevo, Happy New Year to everyone. Enjoy the holidays with your family, and we'll see you in 2024.
yes, 2024. Ciao, everybody.
Bye.